right, well, I'm Dr. John Bruno, and sorry for the delay. We had a little bit of technical trouble, but we're here. I'm going to be talking about the phenomena that's happening where more and more adults are starting to uh, suspect that they are on the spectrum, and they are now entering into all of the resources that come into play, and I'm just trying to understand what's available and what's possible. And I'm the co-founder of iSocial, and I'm also the owner of BrunoAutism.com. And and what I do is for the last really probably 20 years, I've done nothing but worked with really the Asperger's high functioning group of individuals with autism in high schools and in the workplace. And as a result, I've gained an awful lot of experience and skills, and have come upon some very effective strategies that have been helpful, and have been coaching companies and professionals and individuals all over the country and across the world, actually presented internationally as well. And so what I'll do is I'll take you through a quick understanding of the history of autism in the US, and then I'll talk about some of the strengths and challenges, and I'm going to move into the resources and some of the workplace strategies, and then I'm going to try and leave the last 15 minutes for questions and answers. So that's my plan. So often when I present to mixed groups where, it's workplace individuals, EAPs, counselors, I start by showing them this slide, because I really want to set the standard that often when people hear autism, they create a stereotype of someone who's probably needing more supports. And what they fail to think about is the groups, really almost 2/3 of the groups that are much more skilled and therefore often go unnoticed or unrecognized, or it's an invisible disability in some ways. And so I then want to make sure I focus on strengths. So this is coming from Mentra.com. If you're not familiar with Mentra, Mentra is a relatively new website where they basically want to become the LinkedIn for the neurodiverse. And so if you're neurodiverse and you want to log in there and create an account, they will walk you through creating your profile and your account. And then on the employer side, they have employers who are interested in hiring individuals on the spectrum and neurodiverse. And those employers pay a fee to get access to advertise on that site. So it is one of the places that is working to connect. And so on that site are all kinds of resources. And this is just one of them, where they're pointing out some of the most common skills that you will see among individuals that are neurodiverse and on the spectrum. So historically, autism back in 1975 was only recognized in about 1 in 5,000 births. And by 2012, it was 1 in 88. So what we're seeing here is an exponential growth curve. And when you've got exponential growth, that means that you've got multiple factors playing in. And so whatever those factors are, we can take guesses at what some of them might be. Is it better identification? Is it more awareness? Right? All those things. But whatever it is, it's not just one thing, because when you get a curve, it means you've got a multivariate factor going on. And so it's multivariate. But 1 in 88 in 2012, the current stats are telling us that's now 1 in 36 births. So when that hit 1 in 50 births, that's a functional equivalent of 2 out of 100. That's 2% of the population. And we see 1 in 28 boys. So we're not talking about 2% of the entire population of births, which is a very large number. And when we see 1 in 28 boys, we know it's 4.5 times more common in boys than girls. And so that tells us that part of that curve is this is genetic. When you get male-female differences, you're into the genes. And so there are all kinds of research studies looking at the genetic pieces to see what's available and understanding better. Right now, what we've got is probably a condition where we're not assessing autism by a medical procedure. We're not taking a blood test. We're not using some kind of physical measure. We're using communication kinds of measures. And so what we may actually have is not autism, but autisms. And so what's likely coming really in the next 5 years is probably more biomedical markers that will better identify autism and maybe even types of autisms. And so as that happens, we'll then start to understand better how we work with individuals that might come to the autism in different ways, and how it might be affecting and more effective ways to support those individuals. Well, the fastest growing trend is adults and with late identification. And so in 2018, the Centers for Disease Control started measuring adults, which it never did before. And lo and behold, we get that 2% number again, 2% of the US adult population. 4.3 million men, that's about 3% of all men, and over 1 million females at this time, about 0.9% of females. Now, what we also know is that the original studies and efforts were geared towards males because there were more males. And over time, in the last 10 years, we realized that we were not identifying a lot of the females. And so the other big trend is, in the last 10 years, a concerted effort to get better at diagnosing and identifying females. And so as a result, we've seen a growth in the female population. But again, with genetics, when we see a male-female difference, these numbers, these percentages are probably about right when we're talking about X and Y chromosomes and effects on a Y chromosome, which would make it a male, versus two X chromosomes, which has more DNA material to compensate for whatever may be happening on the other X chromosome. So why the adult trend? Part of the trend in the US is related to how we identify autism in younger individuals. So a lot of people don't realize that there's an educational and a medical model, and those are different. The difference is that in the US, the laws that govern special education require that anything that's identified as a disability has to show that there's an educational impact on learning. And that requirement often makes it more difficult to provide services for those higher functioning individuals who are doing fine academically, but are struggling with understanding at middle school why all of their friends don't want to be friends with them anymore, and they don't want to sit at the same table, and how come they've got friends and boyfriends and girlfriends, their peers do, and they don't. And so those social skills struggles start to come in. Other struggles that will come in are emotional regulation. As these very bright individuals become frustrated, they start to become overwhelmed, and they are running in a pre-fight or flight kind of mode in a daily basis. And as a result of that, we see many issues related to stress and anxiety. So again, those often don't get identified as autism, but instead will get identified as something other than autism. So we will see the common trend for the higher functioning individuals that they will start out as a YCDD, a young child with developmental delay, maybe, or an ADD, ADHD with OCD or ODD. So what does that mean? Attention deficit paired with obsessive compulsive disorder, or attention deficit paired with oppositional defiance disorder. And so what you've got is part of the results of trying to function in an environment that these individuals are having trouble understanding. They know they're smart enough to figure it out, and they're confused at why they can't figure things out. They're confused at why things aren't making sense in how they perceive things. And so as a result, a lot of those social struggles do not get addressed, and they get moved on through the grades. And so because of that, and then the second is that original male focus, and as I talked about. So as individuals are now coming into adulthood, and with the impact of social media and the internet, they're starting to ask questions and find support. And as they find support, the question comes up, well, maybe you're on the spectrum. And so many individuals will go to those checklists that are out there and say, wow, I'm checking a lot of these boxes. How do they know this about me? And so their next question is, could I be on the spectrum? And so what we see is that the public resources are starting to see this trend. In recent presentations that I've been to at different conferences, there's reports that in the public uh, services in places like California, there can be up to a 3 to 6 year waiting list just to get into a diagnosis. So the educational model is the first problem. The second one is that the medical model is a little bit is different than the educational model. And so if you are an adult and you go for identification now, you're going to be assessed in the medical model. And that model is determined or bounded by the Diagnostic and Statistical Manual of Mental Disorders, the DSM. Fifth version is the latest version, and I believe that came out in that revision was 2015 or 2018. I can't remember exactly. But what does it say? Well, in the new, when DSM-5 came out, it changed the definition to a social communication, social interaction struggles paired with restrictive, repetitive patterns of behaviors and interests. And so because with that change, more individuals now were able to be caught into this diagnosis and better identified. And then the other change happened was they did away with all of the labels. So Asperger's and PDD-NOS and all these labels that weren't helpful. Instead, they shifted to a severity level, and they said autism level 1, 2, or 3. So think of it as a mild, a moderate, and a severe maybe. And so a level 1 would be the Asperger's, the high functioning, not needing a whole lot of supports. A level 2, benefiting from speech and language therapy supports and needing more support with emotional regulation. And then a level 3, these would be the more what we call classical autism, which would be someone who is very much in their own world, struggling to interact with others, having a lot of struggles with communication, needing ABA therapy kinds of supports, communication boards possibly. So that would be the level 3. So most services are created and directed for that level 3, given the severity of it. But what's happened is a real lack of any kinds of research to indicate what might be useful with an evidence base for the more mild and moderate levels. Along with the increase of more and more individuals on the spectrum that are in the normal to above average intelligence range, what we see is that trend is showing up in college enrollment as well. And so here is that trend line of individuals with autism that are enrolling in four-year colleges. And you can see that there's, again, almost that same incredible growth, which would mirror what we're seeing with the growth in the population, and also what I was saying, which is a large proportion are not the classical, more severe autism, but more of the average intelligence to above average intelligence. So what is the main mechanism here that's going on? And so whatever the possibilities of what's driving the rates of autism, what we know about the autism is that this is a brain that is wired differently. And again, how we get those differences right now, there are multiple factors that seem to be pointing towards it, but all of them have the same effect, that in the wiring of this brain, the joint attention or shared gaze mechanism is what's impaired. And so what is shared gaze, joint attention? This is a mechanism that when a typically developing baby is born, every time they look at mom's face, they are getting a hit of dopamine. No, I don't have that slide. Sorry. I was looking to see if I had a slide for that. And that reward in that limbic system really drives the typical baby to study mom's face. And so as they're studying mom's face and getting rewarded, they're imitating mom's face. And so as mom is narrating and going through different emotions and saying, oh, you like that? And oh, is your tummy upset? And mom lowers her eyebrows and lowers her tone. Baby learns to connect eyebrows and tone of voice with emotion. And so now baby effectively learns to read the emotional state of another person. They start to then say that person is feeling sad, that person is feeling happy. They start to read the mind of the person. This is known as theory of mind. They start to create a theory of what the person might be thinking based on that tone dropping when the eyes drop and said, ooh, are you upset? And they now know a lower tone goes with when someone's upset and eyebrows drop, and they put all of that together. That mechanism is what is working differently for individuals with autism. And so without that mechanism, that the babies that aren't getting rewarded to study a face don't spend as much time on faces. So what is it that they are staring at then? Well, research on eye gaze shows that what they do is they spend more time on the mouth. And the mouth is more of a survival mechanism that is present in all mammals. And a mouth is where you'd want to look if you look at other animals in the animal kingdom that have joint attention. The mouth tells you when an animal is showing its teeth and there's danger. When the pack animals who have social attention, joint attention, when that lead dog yawns, all the other dogs imitate that yawn and pass it back, and it communicates to the pack that we're about to take a rest. And so these mechanisms are built in, but what we see is a difference. And so individuals on the spectrum, we see as early as 10 months old, they're using their eyes differently. They're focusing on the mouth for information, and they're missing the eyes and the eyebrows. And they're more focused on objects. So they might look at mom's earrings and then the ceiling fan and get more interest in those things. The second thing this mechanism does is it teaches babies how to follow eye gaze. And so as mom is talking about something, she'll say, oh, and look, and she'll look at the object she's talking about, and baby learns to share the gaze, as the picture in the top right corner shows, that the baby will look where mom is looking. And so as you learn to follow eye gaze, you learn that what I'm looking at is what I'm thinking about. And that becomes very important, because if I don't understand that your facial expressions tell me what you're thinking, and I don't understand that what you're looking at is what you're thinking about, then I make a lot of errors in not realizing that you weren't ready for a conversation. And so as I'm on a computer or I'm talking to somebody else and you come up, if you don't read that eye gaze, you don't realize I'm not thinking about you, and you just start talking. And so what'll happen then is interrupting occurs. And now they'll get a response like, excuse me, can't you see I'm talking? And the person will say, why were they so rude to me? Well, unless I understand that the eyes tell me what's happening, right? And the eyes are giving us lots of clues. So how do I know to join a group? We teach kids, oh, you go up, you say hello. That's not how you join a group. The way you join a group is if the group is looking away from you, you come and you wait until someone turns and looks at you, and they turn their body to you and they let you enter the group. Then you listen to see what the topic is and you join the topic. And then after you join the topic, you transition to what you want to talk about. So again, understanding eye gaze and joint attention becomes a critical piece. And so what this does is it points out that autism is a communication disorder, because the nonverbal communication and the tone of voice communication is what is getting missed because of that mechanism and how this brain is wired differently. So understanding that difference helps us understand where the strengths and the struggles come in. If I'm paying more attention to objects, I become very good at processing pictures. I become very good at picking apart small details and spotting errors and differences in maybe lines of code or billing numbers or medical billing or medical language. And so again, while I may be losing some ability with understanding facial expressions and what people are thinking, I'm gaining great ability in working with objects and things in the real world. So, and by the way, joint attention has three parts to it. So it's what someone is looking at, it's what someone is pointing at and learning to follow the point, and then the last one is looking at what I'm talking about. And so if the teacher is talking about a PowerPoint, and then everyone in the class should know to be looking at the PowerPoint, and when the teacher changes the slide, everyone should catch that the content has changed. Individuals often on the spectrum in classrooms will not be looking at what the teacher's talking about, and they will miss the cues. So one example was a gifted individual in a high school classroom who was struggling, and I went in to observe him. And the teacher, it was an algebra class, and the teacher puts a problem on the board, and she says, "What comes next?" And he shouts out, "You move the variable." And she says, "Please raise your hand." And he says, "Arr." And then he raises his hand, and she calls on somebody else. Now she turns to the board and she's writing, and now she asks the class while looking at the board, "And what comes next?" And he's sitting with his hand raised, not realizing that she's looking at the board. She cannot see hands. And so the hidden clue there is that when the teacher's eyes are on the problem on the board and she's asking about the problem on the board, you don't raise your hand, you shout out. He now waits with his hand up. Another kid says, "You move the variable." And she says, "Yes." And he says, "Arr." And now she turns back around and she's looking at, and she asks another question, and he shouts out again. And she says, "I've asked you to raise your hand." He's missing the joint attention cues. And now his experience in the classroom is one of great frustration because he knows the answer. He's trying to follow the rules. What he doesn't understand is that the rules change depending on someone's eye gaze and reading that social context. So that's an example of how this mechanism can play out. And so in the literature, you'll see theory of mind, which is that theory of making a guess at what someone's thinking based on their eyes, their eyebrows, their mouth, their tone of voice, their head tilt, their body language, right? Reading all of that and then saying, "I think they're feeling happy. I think they're in the conversation with me," or I think they don't want me to keep talking. Right? Theory of mind is the fancy term for perspective taking. Central coherence is the second issue that we see in the literature that is pretty common. Central coherence is the forest for the trees. So these individuals have an incredible ability to drill down into detail, and so that drilling down in detail often goes at the expense of the big picture. And so what's the main idea of the sentence, and what, looking at all the clues, what's the main thing? And they'll be looking at the details and the individual pieces and missing some of the bigger picture sometimes. And then the last one is executive functioning. So theory of mind, again, is what we need when we want to take another person's perspective, interpret nonverbal communication. If I'm having trouble taking another person's perspective, then I don't have their perspective. So the only perspective I have is my own, which gives me an egocentric view. And an egocentric view can often cause problems because I'm not taking into account other people's views and may not even understand that other people have their own views. And so therefore, I'm getting surprised all the time by how my behavior is impacting others. If I don't realize that what I'm doing is showing up on people's faces as a reaction, then I can't predict a reaction. And so the struggle is in anticipating what face I should expect to see and match that with the face that I'm getting, right? And so that makes it very difficult to predict the environment. When I'm having difficulty predicting an environment, it means I'm getting surprised all the time in social situations. So if I'm getting surprised, that means I'm starting to be startled, and it's going to make me anxious. And so how do I control and eliminate that anxiety? I insist on control. I insist on everything stay the same. I insist on routine. And so what you've got is really this, what often is referred to as inflexible thinking or rigidity. What is often missed by most is that rigidity is coming from the difficulty in predicting. When we give predictability to upcoming environments, when we give predictability through routines, when we give predictability through visual schedules, when we give predictability through written instructions, we lower anxiety. But all of it starts with that ability to take another person's perspective, to read the nonverbals, the paraverbals, tone of voice, and the body language. When I can put those clues together and then put it in the right situation, then I can have the view of others. When I have the view of others, I understand how something's going to sound or come off, and then I'm not surprised. And so then I'm more flexible. So that inflexibility actually often begins with learning to read nonverbal cues, paraverbals, and so on. And so I'll skip through for time. With executive functioning, we're going to see difficulty with adjusting to unexpected problems, with organization, with self-monitoring. Self-monitoring means that I may get lost in time and lose track of time. Difficulty transitioning off of, once I finally got started on something, I don't want to get off of it until I finish, right? And so those can all be part of that executive functioning. The literature tells us also that there are heightened levels of sensory sensitivity. So hyper and hyposensitivity. Hyper, it's too loud, it's too bright, the smells are too strong. Hypo, I'm not getting enough sensory, and so I have to create my own. And so we will see sensory seeking behaviors such as rubbing, hair pulling, those kinds of behaviors, because the brain's not getting enough sensory. This is where, for those of you that are here because of your children possibly, this is where they're wanting to be under a weighted blanket, or put the backpack on all the time, or have that heavy coat on, or looking for squeezes. They're trying to create sensory because they're not getting enough. With all of those things, we get a lot of anxiety. Anxiety is the number one emotion that I'm assisting with usually. And when I can lower anxiety, then executive functioning goes up and sensory issues come down. And the last one is, if I'm processing visually and I'm processing objects, then words become objects, and each word has a picture. And so that picture then becomes a literal object. And so we will get the literal processing of language. That can be a strength and that can be a struggle. So as we think about strengths or struggles, so rigid routines may be a struggle, but someone who follows rigid routines are also a strength, in that person will follow procedures and protocols accurately. And so if I'm part of Mercy Hospital also, and if I've got a cancer cells being sent off to the lab, I want someone who follows all the protocols to diagnose that cancer. I don't want the person saying, I've done a lot of these, that looks pretty much like this, I'll take a gut reaction on it, right? I need someone who's good at following protocols. And so airline pilots follow protocols, chemists follow protocols, accountants follow protocols, right? And so those are great. You see those strengths come into play. Programming has a rule governance to it. And so those places are where individuals that are rigid in routines are also going to often do well in those places. Literal processing of language. These are people going to catch language errors, like in a medical setting where, one letter can change a medication. A centiliter versus a milliliter versus, can change huge amounts of doses. And so we've seen over and over again where people get the wrong dose because someone misread something in the prescription. And so catching those medical errors would be another place where literal processing actually is a strength. Social skills struggles. Well, these are individuals that are not as distracted by office politics or drama. If I'm not as concerned about all of that, then I don't pay attention to it. And so we find workers who we often have to remind to take a break because they're very loyal and dedicated to the job they're doing. And so that can be a strength as well. And then that logical thinking can be a struggle when we're dealing with emotion and nuanced kinds of situations, but it means it's somebody who can make decisions without the cloud of emotion. So the adult world impact, I told you it's the fastest growing. Diagnosis, one of the changes is happening as I talk to psychometricians, ed psychologists, is that they're saying that in the past, when I gave an adult a diagnosis of autism, they would get upset. But now they get upset when I say they don't qualify. And this one individual I was talking with a few weeks ago said, well, the individual said, well, I'm still going to claim it because I know it explains a lot of why I struggled. And so this kind of hints at the autism diagnosis versus the idea of neurodivergence or neurodiversity. Neurodivergence, neurodiversity includes autism, and it started with that group, but it's grown into almost 23 other groups that want to or think that should be part of what is neurodivergence. And so it's a social construct. And so if that explains it and it helps you with your life, great, claim it. You don't need an official diagnosis unless you're trying to get some medical or work-related ADA supports. But otherwise, for most people, the diagnosis isn't all that critical. It just may help you explain. So the other piece that's happening is these professionals, for the first time, are dealing with adults at the higher functioning range, and the adult says, well, now what do I do? And those counselors and psychologists are like, I don't really know, because there's not a whole lot of literature out there to say what to do. So let me walk you through some of those current options. Counseling. Counseling can be good to support emotional struggles and strategies for working through anxiety. Anxiety, again, is the number one issue. Counseling can be good for to help you with becoming overwhelmed. Counseling can be helpful to deal with and learn how to deal with panic attacks. A psychiatrist, often many people say, oh, a psychiatrist, and they'll think it's more like a psychologist. Reality is a psychiatrist is a doctor who's prescribing medications. That's primarily what you're going to get if you go to a psychiatrist. And so often parents especially are confused at why the psychiatrist didn't offer any kinds of other supports other than medication. Because if you're going to a psychiatrist, that's primarily what they are doing, is they are going at the medical side of the mental health and the mental supports. So if anxiety is impairing your life, then medications can be great to help improve that anxiety. If impulse control has caused you problems on the work site, has caused you problems throughout your life with staying with something, staying with a job, then those impulse control medications could be something that psychiatrists remember. And then the other one is sleep disruptions. And so these are common ones that you may want to talk to a medical professional about and see if it rises to a level that medications might be a support. Speech language pathologist, this is a communication disorder again. And so speech language pathologists can help with some of what I talked about, learning how to read nonverbals, paraverbals. This is called pragmatic language. Now, many speech language pathologists don't specialize in pragmatic language. They'll rather work on articulation, so how you say things, helping with lisps and pronunciation, but they are all trained in the social skills and can be a use. If you find the people that are doing that work, they can help with that. OTs can help with the sensory issues, can help with executive functioning, can help with workplace accommodations. Life coaches is relatively new on the scene for the last 5 years. And life coaches can be great for strategies for goal setting so that you learn how to chunk things out and not get overwhelmed and help to plan. They can help with some of the personal relationship skill building. They can help with career goal clarification. Rehabilitation therapists, those are professionals who help with job coaching, interview skills, career advancement, assessing what career you should be in. Recreational therapist, if you're wanting to know how to get more involved with things, where are my peer groups, program identification. And then lastly is the research-based interventions. On the market commercially, there is iSocial. I'm the co-founder of this research out of the University of Missouri. And that research was created mainly for adolescents. And we commercialize that, and we are the champions of that research and keeping it going through iSocial. And then as the adult population was asking for programs, I created the the iSocial version for adults called PCLS, Professional Communication and Leadership Skills. And then also out is anything by Michelle Garcia Winner with the social thinking curriculum. So these are 3 commercial resources that will help you with a lot of the things we went about. So in terms of the adults and support for them, iSocial is the one I was just telling you about. It is out of the University of Missouri research. It uses a 16-week, 32-session, 50-minute virtual model where you come twice a week for 50 minutes and you're with 6 peers, 5, 6 others, and you interact together in moving through the content that works on improving joint attention and understanding the workplace culture and how to create a professional image and conflict resolution. It also teaches you how to self-advocate effectively and what your rights are under the Americans with Disabilities Act. And lastly, how to get ahead in business by learning how to use these skills to network. What is iSocial built on? It's built on the work of Dr. Janine Steester, in which she starting by learning how to read and recognize facial expressions. So there's that joint attention, that theory of mind. Then it moves into how to effectively share ideas. So how to initiate a conversation, how to end a conversation, how to know what your role is as the listener versus the speaker, and then how to read that listener so you know you're on track or off track. And then it gets into more complex turn taking and some of the more higher level conversation skills. And those are practiced through activities, through analyzing video, through group activities where you're even creating scenarios and acting them out. And then it moves into recognizing feelings and emotions and understanding emotional levels, and that an emotion such as mad, sad, or glad can have levels to it. So there can be a level 2 mad, which might be irritated, a level 3 mad, which might be angry, and a level 4 mad, which might be furious. And so then understanding that it's okay to go up on those levels, but you can't stay there very long, and learning how to catch it at a 2, and then using a calming strategy to get yourself down, and what are ones for you. So it works on that emotional regulation piece, because without that, you can't effectively problem solve. And that's the last part. But if you're up at a 3 or a 4, you're not going to be able to effectively identify the problem and effectively resolve it. And so what it teaches is, first, you have to identify that you are getting dysregulated, regulate yourself, and then you can effectively solve the problem. And now we're going to teach you how to identify what type of problem it is and what are better solutions for the different types of problems. So our progression, SCI was the clinical version that was done through the research. And then iSocial, we converted that into a virtual product for adolescents, and we offer those courses and those workshops. And then I created the Professional Communication and Leadership Skills. It's a leadership course for adults. And so we have many professionals coming through that course. So we've had individuals from IBM, Mercy Hospital, I can't off the top of my head, there's so many, but individuals who are now feeling and being telling us they're more successful in the workplace because they have these skills. And then we create social communities as well. So we have, after completing the course, you can join in on weekly meetings where individuals keep getting together and we talk and we practice different skills and we do things. We also have teen social groups and even a game night and an adult interest group. So 65% of the graduates of PCLS have reported improvement in job finding employment, moving into college, doing better in college, and increasing their employment. I'm going to skip the videos because of time, since we got started late. The other curriculums that are out there for the range all the way from pre-K, kindergarten up through adult would be Michelle Garcia Winner's work in the social thinking. She's been around for almost 25 years. And so she's the one who has been doing most of the work that, and really the only one who was doing anything in this space with adults and high functioning before it became a trend. So workplace considerations. I would have you take a look at the Microsoft Autism Hiring Program, and if you Google that and you look at the videos, you'll see how they're adapting. SAP, IBM, Dell, all of these companies now see neurodiversity and autism as a strength. They realize that it's a brain that sees the world differently. And so they realize that if you want creative and different solutions to problems, you need people who think differently. And so these are programs that are actually looking for and creating systems and supports so that individuals on the spectrum can be hired into the workplace. In the workplace, what are the strategies? So I am coaching often workplaces on how to increase predictability. So this is agendas, this is visual schedules. This is following up verbal instructions with written instructions. So if the boss says, I'd like to have that report by 5, and he says it verbally, if he follows it up with an email that says, please have that report on my desk at 5, because it's visual, you're likely to get it. Okay, so increasing, teaching individuals to ask for things to be written down so that they can be sure they understood. Visual, so those are all called visual supports. Increasing roles that require analysis and evaluation. This is the strength of this brain. And then increasing consistency in the workplace. Going to decrease things that might overload sensory. We're going to try and decrease job functions that are very inconsistent. Those are usually not good fits. I say usually because everybody's an individual, but usually these are going to be more problematic. You might want to decrease the need for perspective taking. So I'm currently working with a number of doctors who love doing the medicine, but it's the patient interactions that are difficult. And so they're finding places where their medical expertise can be used, but it doesn't require that they interact directly with a patient, but maybe only with other doctors or with data. And then decreasing verbal demands. So again, this is a communication disorder. And so jobs that have lower verbal demands are often ones that we find more success. But again, that's not true for every individual. And so again, these are just generalities. I'll make that point again. I'm not saying this goes for everybody. All right, so predictability, visual supports, things like graphic organizers. These things help clarify and help us be more direct, and using direct communication. So autism has a unique neurodevelopmental biology. It comes with strengths in memory, attention, detail, repetitive tasks, seeing things from a different angle. Neurodiversity, the term you're hearing, is a social construct, and it keeps evolving, and so it'll keep changing. And so, but it is the term that is going to counter the deficit model or the medical model. And so as a self-advocacy, it is a good thing to have that it is speaking in the positive. Remember that we're seeing 2% of any population now. And so any workplace that says we don't have anybody here with autism is blind to what's happening. And then that growth in support for adults we are seeing, and that's becoming to a head. It's becoming more and more prevalent. And then thinking about how you might use different professionals in a specific way. So I hope that was helpful to you. And so again, you can email me at drbrunoautism@gmail.com if you want more information. Website is brunoautism.com. If you want to take a look at our work with iSocial and the company that I co-founded with Bob Etzel, please join us. And you'll be seeing 2 other presenters coming up that that work with iSocial as well. So with that, I've got maybe no, I don't have much time. So if you have any questions, feel free to email me. But I apologize that we got a late start and that I wasn't able to take questions with only 1 minute left. So hopefully that was helpful. Thanks everybody for coming to the session. I encourage you to join the next session, which will be Corey Ruth speaking on a similar topic, but taking it into the workplace more, and his work as an individual on the spectrum who has worked in high levels of the world of HR. And then that'll be followed by another wonderful presentation that follows. So if you just stay on this track, you're going to get some really solid presentations. So thanks everybody for coming into my session.